That 16-year-old boy who was reported by this newscast on Thursday to be receiving treatment in the COVID-19 intensive care unit at the Ocean View Hospital has died. The unfortunate news was delivered by Minister of Health Dr. Frank Anthony during his COVID-19 briefing on Friday.
That patient had comorbidity. The patient had a form of cancer and unfortunately died over the last 24 hours.
The minister further indicated that as of Friday, there was a total of 7 children hospitalized with the disease. He said while health authorities are yet to confirm the presence of new variants in Guyana, the spike in fatalities and hospitalization of both children and adults points to a new strain of the disease.
One can assume that we have different types of variants that are circulating in Guyana. With the original strain of the original type of the virus, we would have seen that when children got infected, they had a milder form of the disease. But with these particular variants that are circulating, when children get infected, a small percentage of them can end up in the hospital.
Since local laboratories lack the capacity to conduct genomic sequencing, a methodology which identifies new COVID-19 variants using patient samples, health authorities had made arrangements for samples to be sent to the Caribbean Public Health Agency in Trinidad and Tobago and the Icahn School of Medicine in New York. However, for reasons best known to the minister, patient samples have not been sent for testing since January of this year. When questioned on why no further samples were sent abroad for testing, Dr. Anthony indicated that taking such steps would not change the health response to the virus.
Sending those samples for sequencing, it doesn't make much difference in terms of the way that we are treating patients. Treatment options remain the same, and we have to assume that we have those variants circulating.
In response to another question on whether or not samples will be sent for sequencing in the near future, the minister noted that it is currently not a priority.
Again, it's not a priority because, as I said, we are assuming that all the different strains are circulating here.
Globally, the increase in child COVID-19 cases has been attributed to new variants of the virus. Children are said to be at a higher risk for infection, with the Delta variant first identified in India. The Delta variant is far more transmissible than its predecessors and appears to be more deadly to people of all ages as well. It has become the dominant strain worldwide, according to health officials in the United States. Despite a strong likelihood of new variants being imported into Guyana, the government has not implemented any travel restrictions on countries affected by the variants. In November of last year, an 11-year-old girl became the youngest to die from the novel coronavirus in Guyana. Another child, aged 17 from Region 4, also died in May of this year. Temika Rodney reporting for the HGP Nightly News.